Hey everybody, Dr. Green here from Green Dental Care. Wanted to check in today regarding wisdom teeth extractions. In the past we had done a video on post-op instructions for tooth extractions, as well as, if you go to our website, pre- and post-operative instructions regarding oral conscious sedation. And there's different types of sedation as well. So today, people were asking a few questions, just seeing if we could elaborate on wisdom teeth specifically and the types of sedation. So let me just start with the types of sedation. First of all, we offer kind of three levels of anti-anxiety. One is nitrous or laughing gas. Two would be oral conscious or minimal sedation. With this is the one we use the most often. It's reasonably priced. We have basically you take some medicine that we give you here in the office. We get you comfortable with Netflix and a blanket and turn the lights down, and it takes about an hour and a half for it to kick in, where you're kind of out of it. You're not asleep. Again, it's a minimal sedation. It's not deep or general or IV. It's a minimal sedation. And if somebody we go over instructions, if somebody's eaten too much or hasn't followed the instructions, sometimes you won't be sedated quite as much as you would like. But I would say for 99% of people, it gets them over their dental anxiety, gets them through the procedure comfortably. So we use this a lot during wisdom teeth extractions. So about 99% of the time, people are choosing oral conscious sedation, which we do very predictably, to be sedated for their wisdom teeth, and it's worked out great. We've done this for a decade now, and very, very predictable. But some people are just really, really hyped up, and they're like, that's not going to be enough. I need a deeper level of sedation. And so we always have the option to do IV sedation, where we bring in a nurse anesthetist or a dental anesthesiologist. It costs about 4 times more money, so sometimes people balk at that, and it's a little bit harder to schedule because we have to bring somebody from outside the office to ensure your safety. But it is absolutely a standard way for us to sedate people in the dental practice setting. So that's sedation. If you have other questions on that, there's a lot more to it. So just take this as a high-level overview, and we could dive into it with you, the pros and the cons, and tell you more about each and see which best for your medical situation and your history with dental anxiety, because there's a lot of we got to go over your medical history and see if either of these or any of these options are safe for you. So that's really important. When it comes to wisdom teeth, we do all types of wisdom teeth extractions. A lot of times we're getting people that just got out of braces or are in high school or early years of college, and we're getting their wisdom teeth out. But then also, we have people that, say were recommended by their dentist to get their wisdom teeth out when they were younger. For one reason or another, that didn't happen, and now they're starting to act up on them, and so it turns into a toothache or something of that nature or an infection. And we'll handle that too. We're very, very good at this. We do it every day. We have wisdom teeth extractions in this office. It's a tough procedure. Everybody's going to respond differently. So when it gets into post-operative instructions, I would talk to your doctor and just realize, like, everyone's level of pain tolerance and post-op inflammation can vary quite a bit. Some people leave and it's just fine, and some people, they're very sore for a week. So we want to be realistic about this, but it's important to get your wisdom teeth out because we have evolved as a species where most of us don't have room for the wisdom teeth. So they start to push on our other teeth. They cause cavities, they cause gum infections, they cause pocketing, jaw pain, things like that in many cases. And the earlier we can get them out, there's kind of a sweet spot, usually between the ages of like 16 and 20 is the sweet spot. Usually the more predictable and easier it is on everybody. One thing that sets us apart is we also offer PRF, or platelet-rich fibrin, which is basically, we take a little blood draw from you, we centrifuge it, and we use those stem cells to put in the extraction sites, and it helps the post-operative pain to be much, much lower. This has worked really, really well. It's something that a lot of the more advanced offices are doing over the last several years, and our patients are very happy with that. So again, this video was meant to be a high-level overview on types of sedation, what to expect from wisdom teeth extractions, post-op instructions, PRF, things like that. And if you have any further questions, we definitely want to go into more detail when we meet you in person and we talk through your options. Thank you, and reach out to us at 720-845-5252.